Dear friends and global health enthusiasts, on the occasion of the One Sustainable Health Forum devoted to the topic Building the EU Health Union, it's my very great pleasure to give some remarks from the viewpoint of the World Health Summit. So the question is, why do we need an EU Health Union in this context? There are some deficiencies of the current situation in the EU. It is very difficult in the EU to harmonize health policies and to provide a unified answer to both the imminent and future threats to health. This is due to the fact that health is a competence of the member states and in some instances even on local regions. Also, the instruments the EU has, overarching instruments in the domains of economy and science, were not always used to the best possible effect to foster an effective EU health union. One example is the European reference networks, or are the European reference networks at the intersection of science and health provision. They are aimed at a very relevant issue, providing the best possible treatment for people in the EU, wherever they live, in rare diseases. And it has been stimulated and propelled by scientific excellence in very many European regions and states, but it's still lacking the proper, unified, and very devoted and bold support it would need to really reach the level of health provision for everyone in Europe we would expect. But on the other hand, as I said, the European diversity and heterogeneity is also a chance, because it entails a lot of excellence in approaches, and we have a very rich toolbox to use. But it needs proper coordination in the framework of a European Health Union. If we build a European Health Union, we should have a broad vision and broad approach. A health emergency response authority is necessary, but it's not sufficient. It is focused on emergency response, but to create a sustainable and resilient preparedness for all different types of health threats, it is necessary to look into the future, and the binoculars or glasses we have to look into the future, as far as we can, the future always is uncertain, is science. Only science can tell us what are the possibilities and probabilities of diseases, what are the mechanisms of diseases, what should be the reaction patterns to diseases. And therefore the European Biomed Alliance has always proposed to create a European Council for Health with all stakeholders, with industry, with civil society, with patients, with health providers, to create a discussion forum and maybe a guiding mechanism for providing the rational basis for a European Health Union. Thus, let's work together effectively for a European Health Union and for taking responsibility here in Europe for health for all. Thank you very much.